Greetings, I'm Dr. Tammy Lee Demler. I'm a pharmacist here at the Buffalo Psychiatric Center. I am going to be talking about naloxone today. We have had previous educational sessions together. I'm sure that you have seen one of my presentations in the past, and we've talked about nasal sprays. Naloxone is available in a nasal spray, and this will be a topic that may be of interest to you. So we're going to move forward through this topic, and there are a number of videos I'm going to have you watch. And then at the end, you're going to have your pharmacist join you for an activity to help you ensure that you've learned everything that you had hoped to about naloxone today. We're going to learn about what it is. You probably already know how to use it if you ever have to. I hope you don't ever have to, but it's important to know if you do. And any other things that you need to know about naloxone. One of those things is making sure that you store it in a proper condition. Making sure you store it in a place that's not too hot and not too cold, just right at a room temperature storage. So what it is, we're going to watch our first video today, and I'm going to talk to you a little bit after the video. So
Naloxone saves lives. No time to sit idly by. More and more people are dying of overdose from the likes of heroin, fentanyl, and prescription pain medications like oxycodone and hydrocodone. These are all examples of opioids. Opioids are drugs derived from the opium poppy plant or made in the lab. They can treat pain, cough, and diarrhea. But opioids can also be addictive and even deadly. The number of opioid overdose deaths has escalated more than 400% since the turn of the century, with tens of thousands of lives now being lost every year. But many deaths can be prevented with a life-saving treatment, naloxone. When given right away, naloxone can work in minutes to reverse an overdose. Naloxone is safe, has few side effects, and some forms can be administered by friends and family. When is naloxone used? You can save a life. First, recognize signs of overdose: limp body, pale clammy face, blue fingernails or lips, vomiting or gurgling sounds, inability to speak or be awakened, slow breathing or heartbeat. If you see these symptoms, call 911 immediately and consider the use of naloxone if available. How is naloxone given? Home preparations include a nasal spray given to someone while they lie on their back, or a device that automatically injects medicine into the thigh. Sometimes, more than one dose is needed. The person's breathing also needs to be monitored. If the person stops breathing, consider rescue breaths and CPR if you are trained until first responders arrive. How does naloxone work? Naloxone is an opioid antagonist, which means that it blocks opioid receptors from being activated. It is so strongly attracted to the receptors that it knocks other opioids off. When opioids are sitting on their receptors, they change the activity of the cell. Opioid receptors are found on nerve cells all around the body. In the brain, opioids produce feelings of comfort and sleepiness. In the brainstem, opioids relax breathing and reduce cough. In the spinal cord and peripheral nerves, opioids slow down pain signals. In the gastrointestinal tract, opioids are constipating. These opioid actions can be helpful. The body actually produces its own opioids called endorphins, which help calm the body in times of stress. Endorphins help produce the runner's high that helps marathon runners get through grueling races. But opioid drugs, like prescription pain medications or heroin, have much stronger opioid effects, and they're more dangerous. Over time, frequent opioid use makes the body dependent on the drugs. When the opioids are taken away, the body reacts with withdrawal symptoms such as headache, racing heart, soaking sweats, vomiting, diarrhea, and tremors. For many, the symptoms feel unbearable. With continued use, opioid receptors also become less responsive, and the body develops tolerance to the drugs. More drugs are needed to produce the same effects, which makes overdose more likely. Overdose is dangerous, especially for its effect in the brainstem, relaxing breathing. Breathing can be relaxed so much that it stops, leading to death. Naloxone knocks opioids off their receptors all around the body. In the brainstem, naloxone can restore the drive to breathe and save a life. But even if naloxone is successful, opioids are still floating around, so expert medical care should be sought as soon as possible. Naloxone works for 30 to 90 minutes before the opioids return to their receptors. Naloxone may promote withdrawal because it knocks opioids off their receptors so quickly. But otherwise, naloxone is safe and unlikely to produce side effects. Naloxone saves lives. From 1996 to 2014, at least 26,500 opioid overdoses in the United States were reversed by laypersons using naloxone. While naloxone is a potentially life-saving treatment, more needs to be done to solve the opioid overdose epidemic. The National Institutes of Health launched the HEAL initiative in 2018, expanding research across multiple NIH institutes and centers to speed scientific solutions to the national opioid crisis. Research is underway to improve treatments for opioid misuse and addiction, and to enhance pain management. The National Institute on Drug Abuse, or NIDA, is a leading NIH institute for research on opioid misuse and addiction, and its support helped the development of the user-friendly naloxone nasal spray. For more information, see NIDA's website at drugabuse.gov and search naloxone, or visit nih.gov and search NIH HEAL Initiative. General opioid information can also be found at medlineplus.gov. This video is produced by Medline Plus, a trusted source of health information from the National Library of Medicine.
Perfect. So hopefully that helped you understand a little bit more about naloxone. I'm going to go over a few more key messages, and then we're going to show you another video and then have more discussion about naloxone. So as you saw in the video, once an overdose has been identified, even if it's thought to be possible, administration of one of the naloxone formulations is really life-saving. Right now, there are 4 common forms of naloxone. Things are always being improved and created, so that may change over time. And there is actually a newer agent that we can use in the hospital for overdoses as well. That's a similar kind of medication. If you can't see the slide because my face is in the way, it says always call 911. So even if you think it's possible and you have naloxone available to you and you're in the community, always call 911. That is never a wasted call. Even if they come and that they identify there's something else wrong, that help to that person will be critical and essential. These are the 4 forms that we see, moving by where it is. Well, we'll go to the left. So the nasal spray Narcan, probably the most familiar to you. There's also an auto-injector that's a Vizio, and from my memory of this, there's an audio prompting that goes with some of these that tells you what to do, like almost as if it were an AED. There's a nasal spray with a yellow cap, and there's an intramuscular syringe that is usually only used in a hospital situation, but some people who are very, very prone to overdose, they may have injectable formulations of naloxone based on what their doctor has chosen for them. The step-by-step process for the Narcan nasal spray, which you can get over the counter now, is that you peel back the package, you remove the device, so you got to take the packaging off. You're going to want to hold the device with your thumb as it's shown here on the bottom of the plunger and the 2 fingers on the nozzle so that you can get a nice firm grip on that device. And then although this man is sort of situated as if he were standing up, obviously most people would be lying down on their back, you'd place and hold the tip of that nozzle in either nostril, it's one nostril or the other, until your fingers touch the bottom of the patient's nose. So you're going to position it in there, and then you're going to release that plunger, firmly pushing to release the dose into the patient's nose. The direction obviously would be into the nose as if you were breathing in, but if a person stopped breathing, that's not going to be expected. Even if they're not breathing, you're going to get some of that medication into the nasal passage. It'll be absorbed, and it'll do what the naloxone video showed. It'll push off that opiate from the receptor and help that person be able to resume breathing again. Again, you're going to press that plunger firmly to release that dose into the patient's nose. And more than one dose may be needed. So this is another walkthrough. Hope you like this one as well.
Hi, is one of you Miss Hall?
Yeah, that's me, but please call me Marty.
And this is my roommate, Jen.
Hey.
I told Charlene I thought it would be good if she sat in.
And I'm her ride anyway, so I might as well learn something, right?
Yeah, well, it's nice to meet both of you. My name is Jack Cartwright. I'm a clinical pharmacist, and I'd like to show you how to use the Naloxone nasal spray in case of an opioid overdose. Is that okay?
Yeah. Sure.
Great. We're going to be doing a bit of hands-on training in a moment, but I wanted to make sure that you knew that this wasn't your only chance to learn everything. We also have written materials you'll be able to take away with you, and we're going to have videos online you'll be able to watch at any time. So if you're concerned you won't be able to remember everything after you leave here today, it's okay. There are lots of ways to review the instructions and information later. That sound good?
Yeah.
Sure.
Great. Okay, so here is your Naloxone nasal spray, and we'll go over it together. Okay, so rule number 1, bring your Naloxone nasal spray with you wherever you go. If you're driving, have it in your car. If you go inside your home, take it inside with you. If you go on vacation, they go with you.
So, like a diabetic would keep her insulin with her.
Right.
Or an EpiPen if you were allergic to bee stings.
Exactly. Rule number 2 is don't store the nasal spray for prolonged periods of time in extreme temperatures. You should avoid heat, cold, or direct sunlight to try to keep it at room temperature. Otherwise, the drug may not work as well. Now, do you remember what rule number 1 was?
Bring it with me.
Exactly. You never know when you might need it. Now, you already went over the signs of an opioid overdose with Charlene, right?
Yes. Check, listen, look, and touch. So, check for deep sleep, shaking won't wake you. Listen for snoring that sounds like choking, breathing stopped, or really slow, like once every 5 seconds. Look for blue or gray lips or fingernails. And touch for pale or clammy skin.
Bingo. So now you know when you might need to use the naloxone. Now let's make sure you know how to use it.
So when I talked to Charlene, I thought it was just like nasal spray you get for allergies or whatever, but she said not exactly.
Yeah, it's a little more to it than that. Although the positioning of the fingers, which we'll go over in a minute, is similar, there's one very important difference. You should not prime or test the spray because it only has 1 dose in it. This is really important.
Okay.
Okay, yeah.
What's nice is there are lots of places to get information about using the nasal spray. In fact, there are 4 places.
Case 3rd time's not the charm.
Stop.
Well, we know overdose emergencies can be really scary, and we want you to know what to do even if you're frightened and overwhelmed. That's why we do these sessions and why it's helpful to have the information in multiple places. So the 4 places to get the nasal spray instructions are 1, right here on the box itself. 2, inside the box, right here. This also has Q&As, side effects, and other pharmaceutical information. 3, on the Quick Start Guide, which is located inside of the nasal spray. And just in case that's not enough information, the VA's put together this really easy to read opioid overdose brochure.
Thanks.
So, yeah, like you said, a lot of places to get information.
Right. Now, the VA's brochure isn't meant to replace the instructions that come in the box, so you should definitely read those too. So now that you know where the instructions are, let's talk about the actual nasal sprays. In each box, there are 2 nasal sprays. Now, the sprays come sealed in plastic to keep them clean. And since these are your nasal sprays, we're going to keep them sealed, but I'll walk you through the next steps. To open the package, turn it over and find the tab marked with a circle. You peel it back and remove and review the Quick Start Guide right there. Now I've brought a demonstration device we can look at. So to use it, hold the spray by putting your thumb at the bottom of the plunger and your first and middle fingers on either side of the nozzle. Now remember, do not prime or test the spray because you could waste the life-saving medication inside.
It's so tiny. Look at that.
Wow. It's amazing how this could save your life.
I promise, it works. Now to administer the medicine, I'll show you in here. You tilt the person's head back like that, and you want to give support at the back of the neck with your hand. Now gently insert the tip of the nozzle into the person's nostril until your fingers on either side of the nozzle touch the bottom of the person's nose. Then press the plunger with your thumb firmly all the way in to give the full dose of naloxone.
And how do you know that you've given the right dose?
Once the plunger won't push in anymore, you'll know you've given the full and correct dose.
Is it possible to give too much?
You don't really have to worry about that. The spray only contains 1 dose, and you can't really overdose on naloxone anyway.
And 1 dose does it?
Usually. But if the person's still showing signs of overdose after 2 or 3 minutes, or stops breathing, which can happen, then you give a second dose. That's why there's a second naloxone spray in the kit, just in case you need it. You'd follow the same steps as you did with the first dose. It's important to call 911 right after you've given the first dose, so paramedics will be on their way.
Wow, I'm glad that we had that second dose.
And I can see why you'd want to call 911.
Yeah, you definitely don't want to do this all on your own. Okay, the last thing I want to point out is what to do after you've used the nasal spray. Once it's been used, make sure you dispose of the spray in a safe way. Make sure you throw it away out of the reach of children, as it says there.
Got it.
Okay.
Great. Also, if you use your nasal sprays or if they expire, it's really important to let your provider know and ask for another one. If you use the nasal sprays, we'll want to check in to find out what happened, how you're doing, and see if there's anything else we can do to help. We'll be sure to send you a new prescription right away because you should never be without one. Any questions?
No, that makes sense. Just hoping I don't have to cross that bridge.
That's for sure.
Yeah, and we hope so too. And that's why the education Charlene gave you on how to prevent an opioid overdose is so important. Hopefully you won't need to use the nasal sprays, but if an emergency did happen, you're now both fully trained emergency naloxone administrators.
Thanks.
Thank you.
Great. Well, if we don't have any more questions, I can get this stuff packaged up and take that home. I'll take this back. Great.
So that is the video on naloxone, another reinforcement. The only thing that's changed is now it's over the counter, so you don't have to get a prescription. But I would still talk to your doctor about the potential needs you may have for naloxone, because that may kind of trigger other conversations about pain management. And we'll talk about how to avoid opioid overdoses at the end as we get a little closer to the end of our program today. So looking at things that you need to know, we'll talk about each of these things separately, but what are opioids? We covered a little bit in the video. Preventing overdose, I have that down there twice because it's super important. And if you suspect an overdose, what to do. Summary of how to avoid opioid overdoses and finding a network of support. All those things are really important things. So what are opioids? We know that those are pain relievers. I think I might have had an earlier note about what those are. Pain relievers like they described. It can be for hydrocodone, codeine. They mentioned also for diarrhea. There can be opioids that are used to help with that because opioids are constipating, and sometimes we use that pharmacologically for our advantage, but it's not very common anymore that that's used. But relatives of opioids can still be used. Preventing an overdose, we'll talk about that. I guess we could talk about it now in case we run out of time, but taking your medications only as prescribed to you, as prescribed by your doctor, and only those who have been prescribed for you. So only the medicine if it's been prescribed for you. Do not take any more or more often than prescribed for you. Call your doctor if your pain gets worse or if it's really not being addressed with the medication that you're using. Never mix pain medications with alcohol, sleeping pills, or other substances, especially illicit substances that would otherwise be maybe considered recreational would be the way to be described, like marijuana would be an example of those. Store the medication in a place where children and pets can't reach it, believe it or not. We're not talking about just adults getting overdosed. It's unintended overdose by exposure by pets or by children, which is very scary. Learning the signs of overdose and how to use naloxone, to making sure that the person who is taking the opioid doesn't have a fatal outcome. Teaching your family and friends how to respond to an overdose. So just you're simply listening to this today, sharing that information with a friend or a family member. And then as the pharmacist in the video described, making sure that you're throwing away not only naloxone in an appropriate way, but disposing of opioids in a safe and responsible way once you're done using them or once they've become expired. You don't want to hang on to old expired medications, and just throwing them in the trash in a vial is not a safe way to go. There are plenty of ways to dispose of opioids. There are drug take-backs that you can take it to You can also, there are drug drop-offs at different locations, but you can also mix this old medication with coffee grounds, mix it in, and coffee grounds are really the best thing. They'll dissolve in there, and you can put them in an old laundry container that would be safe from exposure from children. There's a lot of different ways to get rid of old medication, and maybe we'll do a module on that. I think that might be a good thing, is to give you some examples of what to really do and how to dispose of any medication safely. And then if you suspect an overdose, remember in the video they talked about a limp body, fingernails or lips that have blue tinge to them. The person may be vomiting even if they are unconscious. If they're vomiting, you'll want to make sure that they're kind of on their side and not inhaling the vomit, kind of on the side, so that they can just vomit in a way that it comes out. If they can't be awakened, if they are unable to speak, or if they have slow breathing, or if it's stopped it completely, those are signs of overdose. And signs of over-medication that can lead to overdose, this is interesting. So somebody may not be entirely in an overdose situation, but they're getting to a point where their medication is so strong, or they're in a situation where a change must be made. You would be expected to see somebody who's very, very tired all the time, unusual drowsiness, mental confusion, maybe slurred speech. They might appear to be intoxicated, but they would be really on just another medication, not alcohol. Slow or shallow breathing. Pinpoint constricted pupils can be an example. So if you have dilated pupils, the black part is very big, and if they're constricted, it's very small. It would be considered the pupil being constricted. Low blood pressure or slow heartbeat. You can, always take somebody's pulse, even if you don't know how to necessarily do that exactly. You can kind of grab the wrist and feel a pulse. If you do that right now, you'll be able to feel your pulse. And if the number is less than 60 for a minute, if you look at and you count and you have a minute clock, that's on the slower side. People who are overdosed are much, much slower than that, and being able to have difficulty seeing them being awakened from sleep or from rest. So those are things to look for. And we talked about how to avoid an opioid overdose just now, and I'm hoping that you remember that we talked about, again, just taking your medicine as prescribed. Do not change the instructions without talking to your doctor. Do not share or borrow somebody else's medication. Certainly never use anything that would be illicit or off the street or recreational. Those are always a risky endeavor. If you do find yourself becoming dependent on your pain medicine, you need to have a conversation with your doctor about how you can get out of that situation, because that can lead to very serious consequences. And I would say one of the other things that you want to be able to do is finding a network of support. It's difficult to sometimes do that, but there's plenty of resources for overdose survivors and family members. So even if you're not the one who had the overdose, survivors of opiate overdose have experienced a life-changing and traumatic event. They've had to deal with the emotions of that overdose, and it can involve a lot of feelings: embarrassment, guilt, and anger. Sometimes gratitude, if you were the one who was able to survive something like that. But there's a ton of things that you need to be able to talk to somebody about. A lot of things can contribute to overdose. It's almost always an accident, so there's no need to be embarrassed that it happened. These are all tips that come from really reliable references and resources. And so if the individual who has experienced that overdose is not the one who had endured the traumatic event, family members can sometimes feel inadequate as support. But other support structures and organizations can include healthcare and behavioral health providers. You are in right now a facility that have plenty of those. But when you leave the hospital and you go into the community, you may find that you need to reconnect with somebody if you're feeling that any of these either survivor experiences, or if you are struggling with dependence yourself. Peer-to-peer recovery groups such as the Narcotics Anonymous, it's similar to Alcoholics Anonymous. There's faith-based organizations that provide a lot of support as well. Making sure that you're connected to a group that would be reflective of your beliefs and have people that can support you. Educational institutions offer support, so people who maybe are in a university or college setting, maybe going back to school, there's a lot of support. You just need to make sure you know where it is before you need it, so that you are not searching for it when you're really past the point of really needing that. Sometimes there can be neighborhood support groups, there can be government agencies, and family and community support programs are all an option for support. Again, if you're struggling now while you're here in our hospital, talk to your doctor. When you leave, you'll be connected to a doctor as well. Keep that conversation going, especially if you continue to struggle with that. So hopefully that's going to give you a little bit of a cause to pause and have some support with that. And we're going to do a little wrap up and review of the lessons learned. So hopefully we'll be able to speed through this and you'll get an A++. And like I said before, your pharmacist will be up in just a few minutes to do an activity with you. So what is an example of an opioid? So an opioid is either A, vodka, B, marijuana, C, hydrocodone, or D, naloxone. I'll give you a minute to think about that. Okay, if you liked answer C, you are correct. Vodka is alcohol, so that's not an opioid. It can be very depressing, central nervous system depressing, and added to an opiate, very dangerous. So if you're ever taking an opiate, you should never mix it with alcohol. Again, remember, opiates do have very important role in our medication toolbox. People who have very serious pain may need an opioid, but if you're ever in need of an opioid, it should only be for a short period of time, and it's not really the true solution for pain that's chronic. Here at BPC, if you get an opioid medication, your pharmacist will come up and talk to you about that and to provide you with resources, and you can ask questions, and we find that to be very helpful. Marijuana is, people either eat it or they can inhale it. It's a central nervous system depressant. While it's touted as being something that can cause relaxation, it also comes with consequences, so it should certainly not be mixed with your pain medication. And I don't advise anybody to participate in recreational drug use anyways, so I would not be in favor of that choice at all. And D, naloxone is the opiate rescue. It's an antagonist, and so while it's related in a weird sort of way, it's an opposite to opiate sort of medication. It's an antagonist. All right, excellent. So let's get on to the next question. What is naloxone? So your choices are an opiate, a stimulant, an opiate antagonist, or a controlled substance. So one of those choices are correct, and I think I probably gave you the answer. So what do you think is the right answer? An opiate antagonist, exactly. So it's not an opiate. It fights against an opiate. It competes with an opiate in the body. It's not a stimulant, because a stimulant would be, an example of a stimulant could be Ritalin, if somebody takes a stimulant for ADHD, or stimulants can even be caffeine. So stimulant would be something that perks up the central nervous system, much more attention, much more energy. Stimulants, too much stimulant can be dangerous as well, cardiovascularly. So too much of anything is not good. If a doctor prescribed a stimulant and you happen to need an opiate, they would have to manage that very carefully. But a controlled substance is not naloxone. Naloxone you can get over the counter. It was not the case a few years ago. You would have to get a prescription, but now it's very available. And an opiate is a controlled substance. And I think we went over this briefly in one of the previous classes, that a controlled substance is a medication that has a potential for misuse, usually physical dependence, sometimes addiction based on the medication. But it's not just opiates, but opiates are generally, for the most part, one of the higher levels, more serious schedules with a very restricted time frame to get refills and numbers of days that you can have dispensed and expiration of the prescription itself. All right, excellent. Next question. What should you do if you suspect an opiate overdose? Your choices are call 911, contact crisis services, call the psychiatrist, and the last choice is look in the person's pockets for identification. There's only one right answer. It's your first step in recognizing and suspecting an opiate overdose. Which of those do you like? Call 911. Absolutely. Now, in the video, the pharmacist did mention giving that dose of naloxone and then calling 911. And the purpose there is that calling may give you seconds of prolonged periods of time before you can actually get that dose into the patient. So depending on the situation, if you have somebody else that's with you, have them call 911. If you're alone, I advocate it equally as well. If you can maybe put your phone on speaker, dial 911, and while you're on speaker, give that naloxone if you can do it at the same time. Having 911 delayed may have the rescue team delayed as well, but if I had to do one thing first, I would give the naloxone because that could save that person's life immediately. Crisis services sounds appealing, but really crisis services is going to be a person on the other line, more often than not, able to respond to people who are thinking about suicide, perhaps carrying out a plan that would be intentional to take them to a path of suicide. That's an immediate intervention, somebody to be able to talk to them who is an appropriate referral, a reference, a resource that would be able to do that. So I would not say that's appropriate for somebody who is in an opiate overdose. Calling a psychiatrist at some point would be important, but not at that very moment. There's not going to be much that they can do either. Naloxone and 911 would be your answer. And then looking into the person's pockets for identification, that I wouldn't do. I would certainly say that when 911 rescue team gets there, that they're going to end up doing that kind of thing and transporting them to a hospital and all of the necessary interventions that need to happen for notification and getting them admitted to the hospital. So your best bet is 911. Okay, how can an opioid overdose be avoided? Options here, there may be more than one. Let's see what we like. Take the medication only as prescribed and call your doctor if your pain gets worse. Never mix pain medication with alcohol, sleeping pills, or illicit substances. Do not take more medication than prescribed or more than instructed, or more often than instructed, or all of these things. What do you like? Do you dislike any of them? I kind of like all of them. Yep. Again, taking your medication as prescribed and calling your doctor if your pain gets worse. One thing I would recommend is when you get your medication, your prescription initially, is that you read back the instructions to the pharmacist and make sure that you understand them. So having taking your medication in a different way than the doctor intended could be a mistake. So you want to make sure that you understand what is prescribed. If your pain gets worse with the prescribed regimen or the intended dose that you should be getting, talk to your doctor first. Not only would it be dangerous to you to take more than he prescribes or she prescribes, but you'll run out of it more quickly than you would expect to, and the dose and refill amount has to reflect what you're actually prescribed. So never mix pain medication with alcohol, absolutely true. It's a good idea not to mix anything with alcohol. I don't advise drinking alcohol. There are so many other alternative beverages that are better for you. But again, certainly don't mix it with other medications. Sleeping pills can have the same respiratory suppression and CNS depression, so mixing those makes that worse. Almost any sleeping pill, whether it's a benzodiazepine or an Ambien-like medication, they're all similar in their effect on the brain and on that system that was shown in the video. And illicit substances, I cannot tell you enough to avoid those. You never can expect a good outcome with that. So please avoid illicit substances at any point. And that's even a shared medication. Somebody being, trying to help you out by giving a medication for pain if you're in pain. Don't take anybody else's medication, even if there's somebody who's trusted. You don't know where they got that medication or that substance. Do not take more medication than prescribed or more often than is instructed. Again, this refers to you need to have your doctor recommending and providing you the prescription recommendations. Going beyond that or outside of that is not going to be a safe choice. And with that, I think we're out of time. Again, your pharmacist will be up in just a few minutes, if they're not already in the room, to do the activity of learning today. And I thank you for your time, attention, and we'll see you again real soon. Bye-bye.